Okay, so I'm going to be doing a full physical assessment. The first thing I will do is check the patient's chart, their history, their orders, the age, their sex, date of birth, name, and also I am going to perform hand hygiene. When I enter the room, I will make sure there's adequate lighting and there is privacy for the patient. All right. So, hello, my name is Akila. I am the student nurse who will be taking care of you today. Can you please state your name and your birthday?
I'm Ida Jackson, and my birthday is August 2nd, 2000.
Okay. Do you know where we're at today?
The hospital.
And do you know the date?
January 24th, 2021.
Thank you. So today I am going to be performing a full physical assessment on you. I'm going to be checking you from head to toe, checking for any abnormalities, and I will be checking your eyes. Just to name a few, your eyes. I'm going to listen to your heart rate. I'm going to be checking your skin the whole time, and I want you to let me know if you have any pain at all. Okay? I will let you know what I am going to be checking prior to doing it so you're aware. Okay? So, first thing I want to do is check your hair and your scalp, okay?
Okay.
So, we'll start from the head and work our way down. So, I'm going to put my gloves on. Your hair looks nice and moisturized. Looks healthy, even distribution. Do you feel any pain or tenderness when I touch your scalp? I do not feel any lumps, any masses. Your head shape looks normal. Okay. And now I want to take a look at your ears. Grab my pen light. So, checking behind your ears. I know you had a nasal cannula on, and we always want to check for skin breakdown or cuts from those cannulas, those tubes. All right. Now I'm checking your ears. I'm not seeing any drainage at all. Your eyes, I didn't see no drainage, no edema or swelling, no redness. I'm going to pull down your eyelids if that's okay. Check your conjunctiva, your sclera looks good as well. Your eyelids are formed and they look nice. They're nice, and your eyes are symmetrical. Your nose is midline. All right, so your whole face looks symmetrical. All right. So now I want to palpate or touch your ears. Please let me know if you feel any tenderness at all. Any tenderness?
No.
Okay. Your ears look aligned. Your pinna is shaped. Shape is appropriate. Okay. So now I am going to check your eyes. Okay. But first, let me have you raise your eyebrows. Can you frown for me? Can you smile? All right, great. So I'm going to take a look at your eyes now. You check your pupils for normal constriction. So I'm putting my hand between your eyes so that way when I flash direct light into your right eye, it does not go into your left eye. Okay? So I'm going to look and keep the light 10 to 12 inches away from you. Okay? All right. Normal pupil constriction and left eye is consensual. I'm going to check your left eye now, your left pupil. Okay. Normal constriction and your right eye is consensual. Perfect. Now I want to check the six cardinal gazes. So this is going to check your this is going to check your eye muscles for movement. Okay. So I want you to follow my pen light, the tip of the pen light. Okay. Very good. Now I'm going to perform convergence. So I want you to follow my pen light to the tip of your nose. Okay, I'm going to go back out about 10 to 12 inches. I want you to take a look at the tip of my pen light and now look at the laptop. Okay, back to the tip of my pen light. Back to the laptop. So accommodation. All right, perfect. So I'm going to check inside of your nose really quick. All right, so I don't see anything abnormal in there. Can you press your finger to your right nostril and breathe through your left nostril? Okay, great. And do the opposite side. Awesome. Okay, like I said, your nose is midline. So So I'm going to check your mouth now. So your lips look nice and pink, moist. They're not chapped. No blisters, no bumps. Can you open up your mouth and stick out your tongue? Okay, your tongue is normal color. It's nice and pink. You can stick it out. Can you bring your tongue back in? I want you to push your cheek out with your tongue on the right side first. And now do the left side. Open up your mouth. Say ah.
Ah.
Okay, I don't see. I'm going to look inside your mouth. I do not see any bleeding. Your gums look normal. Your teeth look nice and aligned. They're nice and white. Do you have any pain in your mouth at the moment?
No.
Okay, no inflammation, no redness, and no bleeding inside of your mouth. No lesions. Looks good. Okay, so now I want to check your trachea, which is, have you lift up your neck for me? Okay, your trachea is aligned. I don't see any swelling, and I'm going to touch your neck, your trachea. I want you to swallow for me. Okay, so it's normal swallowing. Great. All right, so since we're on your neck right now, I'm going to have you do range of motion. So I want you to rotate your head to the right, rotate, come back to the middle, rotate left. Great. Go back to the middle. Now I want you to flex your head down to your chin, back up to the center, and extend out. Great job. Okay, now I want you to abduct your head to your right shoulder, your ear to your right shoulder, abduct back up, abduct your left ear to your left shoulder, abduct back. Great job. Okay, so range of motion of your neck is great. All right, so now we are going to work our way down to your chest area. I'm going to check your cardiovascular area, okay? So, first, okay, we're going to pretend like your shirt is off. Okay, your shirt would be off. You would just have on your brassiere. And I will only expose the areas necessary, okay? So, I'm going to be looking at your skin. I'm going to make sure you have normal pulsations in your chest, which looks normal. The skin looks normal, no lesions, no abnormal moles, no abnormal growths, no edema. Okay, so now I'm going to palpate. Okay, I'm going to also do it for 5 seconds. All right, I'm going to palpate your apical pulse. Okay, normal. All right, awesome. Now I want to listen, auscultate your heart valves, okay? So I'm going to warm up my stethoscope first. I'm going to warm it up on the diaphragm side first. All right, so now I'm going to go from your clavicle, go down to your second intercostal space, on the right sternum border, and I'm listening to your aortic valve. I will listen for 5 to 10 seconds, go over to the left side, left sternal border, listening to your pulmonic valve. Then I'll go to the third intercostal space for the Erb's point. This is the best place to listen for heart murmurs. I forgot to mention the aortic valve is the best way to listen to the S2. All right, I am doing 5 seconds each point. Work my way down to the fourth intercostal space, left sternal border. I'm listening to the tricuspid valve. Then going to the mid-clavicular line, fourth intercostal space, and I'm listening to the mitral valve. This is also where I will assess the apical valve as well, apical pulse as well. Then when I'm done listening for 5 seconds, I will warm my stethoscope, use the bell side, and go backwards. So I'm in the mid-clavicular line, listening to the mitral valve. Now I'm going to go over to the left sternal border in fourth intercostal space, listening to the tricuspid valve for 5 seconds. Work my way up to the second intercostal space, left sternal border, listening to the pulmonic valve. Slide right over to the second intercostal space, right sternal border, listening to the aortic valve, and then I will work my way up to the carotid artery. I'll have you lift your head up for me, please. I'm going to be checking for bruit. So I'm going to hold my stethoscope up to the carotid valve, and I'm going to have the patient take a deep breath. Hold your breath and breathe out. I didn't hear anything, which is good. That means no signs of bruit. We check the other side. Take a deep breath. Hold it. Okay, no signs of bruit. Go ahead and release. Thank you. All right, awesome. So now we're done with the cardiovascular system. I'm going to check your respiratory system, or your lungs, okay, and your breath sounds. So first I will look at the chest area. Looks normal. There's no barrel chest, which would be rounded. There's no pigeon. Her chest not pigeon, which would be winged. Okay, it looks normal when she breathes. Her respirations look good. She's not straining or struggling to breathe at all. So I'm going to palpate for normal breathing. Do about 5 seconds each area. All right, 5 seconds. Now I'm going to listen to breathing sounds. I'll start with the APCs. I'm going to start on the right-hand side. I'm going to use the diaphragm. Make sure I warm up my stethoscope. I'm going to listen. I'm going to have the patient breathe twice before I move over to the next area. So I'm going to have you breathe twice before I move over, okay? So go ahead and take 2 breaths from your mouth. Very good. That's the right APC, and then the right apex area, and then I'm going to do the left apex area. 2 breaths. Great job. So get 2 breaths. I'm going to work my way down, and I'm doing the left upper lobe. She took 2 breaths, so I'm going to go over to the right upper lobe. 2 breaths. I'm going to go to the right mid lobe. 2 breaths. I'm going to go over to the left upper lobe. 2 breaths. And also the right lung has 3 lobes. The left lung only has 2 lobes. So I'm going to go down to the lower left lobe. I'm going to go to the right mid lobe. 2 breaths, of course. Right lower lobe. Patient took 2 breaths, of course. Left lower lobe. And 2 breaths. Great. Okay. So now I'll have the patient swing her legs over the bed. I'll have you swing your legs over the bed. I'm going to be checking the back. Your back, your posterior thoracic area. Checking for your respirations again and breathing, okay? Your lung sound. So I do not see any abnormal lesions on the skin, any swelling. The body looks contoured. Spine is midline as normal. Not distorted at all. And I'm going to check palpate now. Do you feel any pain?
No.
Any tenderness? Okay, muscles feel normal. I'm going to touch your back, and I want you to say 99 for me.
99.
Okay, say it again.
99.
Say it again.
99.
Okay, I'm checking the vibrations, which are equal. All right, and normal. All right, so now I need to listen to your lungs again, your breath sounds again, okay? So we'll do the 2 breaths again through your mouth like we did before in the anterior area, which is the front, okay? I'm going to warm up my stethoscope again, the diaphragm of the stethoscope, before I touch your skin so it's nice and warm, okay? So now I want you to breathe twice, checking the left upper lobe, moving over to the right upper lobe, and breathing twice. Go down to the right upper lobes, go over to the left upper lobe, down to the left lower lobe. I'm going to go to the right middle lobe, down to the right lower lobe, the left lower lobe. I'm going to go to the mid-axillary area on the left-hand side, and then I'm going over to the right mid-axillary area. Okay, and each time you took 2 breaths, so great job, thank you. So I did not hear any crackles, any wheezing, any stridor, anything abnormal. Stridor would be well sound. I'm not hearing any wheezing at all or any crackles. Okay, so you had normal breathing, breath sounds. All right, so now I'm going to have you lay down for me, please. I want to check your abdominal area, which is your stomach area, okay? So, first thing I'm going to do is take a look. Make sure you have no abnormal pulsations. Your stomach is nice and flat. You have no scars, no lesions, no swelling. It doesn't look bloated or distended. I am going to feel for that. But first, I need to listen to your bowel sounds. Listen to the sounds inside before I touch your stomach, because I do not want to distort anything. Okay? So the first thing I'll do is listen. I'm going to start where your large intestine begins, which is your right lower quadrant, and listen for 5 to 10 seconds each area. Going up to your right upper quadrant, 5 to 10 seconds. Left upper quadrant, 5 to 10 seconds. Left lower quadrant, 5 to 10 seconds. All right, great. Now, I didn't hear anything abnormal. I heard sounds, which is normal. So, sounds normal. Everything sounds normal in there. If I did not hear anything in your stomach, I would have to listen to each quadrant for 2 to 5 minutes each to make sure that there is no bowel sounds at all. Okay? So now I'm going to palpate or touch your stomach. I'm going to check for any swelling, any bloating. Make sure your stomach is nice and soft. I'm going to go light and deep as I'm going to check each area, okay? You let me know if you feel any pain or tenderness. So this is your right lower quadrant, your right upper quadrant, your left upper quadrant, and your left lower quadrant. Okay. And also, I do not see any abnormal hair growth on me either, which I forgot to mention. So now I want to check for your range of motion and your strength. I'm going to start with your upper body. Excuse me. All right, so first thing I want to do is check your shoulders, the range of motion of your shoulders. So I'm going to have you take your right arm and raise it above your head. So you're going to flex up, extend down. You're going to do your left side, flex up, extend down. Very good. I want you to bring your arms to your side, which is abduction. So you're going to abduct out, adduct in. Same with your left, abduct out, adduct in. Great job. Okay. So now I want you to hold your arms out like this. We're going to check your wrist flexion and extension, okay? The range of motion of your wrist. So I'm going to have you flex your hands up and extend down. Very good. Flip your hands over. Flex up. Extend down. Great job. Bring your hands over. I want you to abduct your fingers, meaning open your fingers up, and adduct in, meaning close them. Great job. I want you to close your fists. All right, great job. And I want you to open your hands up. I want you to touch your fingers to your thumbs on each hand. One at a time. Very good, very good. Okay, now that you have your hands out, I want to go ahead and take a look at your hands and your fingernails. You have normal capillary refill. Your nails look good. They're a rectangle shape and they're rounded. There's no clubbing of your fingers. Your fingers look nice and normal. Okay? Okay? All right. All right. And I just want to double check. I know I checked your ears. Yeah, I did check your ears earlier for any cuts. Okay. So now, let's see. I want to check your strength of your arms. So I want you to resist when I push. I want you to hold your arms out, and I'm going to push down. I want you to resist. Very good. And I'm going to check the opposite way. So I want you to resist. Very good. Nice and strong. I want you to grab my fingers with both hands and squeeze. All right. So nice and strong. Okay. So now let's do your lower body. And, oh, I'm sorry. I want to check your muscle mass as well. So I do not feel any bones out of place. Do you feel any pain?
No.
Okay. Your arms are nice and symmetrical. Your skin looks good on your arms. No lesions, no cuts, no abnormal moles, no swelling. Okay. Same with your hands. Okay. All right. So we're going to do your lower body. So I'm going to check the range of motion of your hips. So first thing I want you to do is flex your leg up, which is raise your leg up. So flex your leg up, extend down. Left leg, flex your leg up, Extend down. Very good. I want you to abduct your right leg out. Abduct in. Abduct your left leg out. Abduct in. Very good. I want you to rotate your right foot in towards your left foot. Just checking your lower leg range of motion, back in, and rotate your left leg towards your right foot, and rotate back to center. Great job. Okay, now I want you to bend your right knee up. Just bend your right leg. Checking your knee motion. Great job. Straight out, and bend your left leg. Great job. Bring it back out. Okay, I want to check your ankle and your dorsal flexion. So I'm going to have you bring your toes, point your toes towards you, towards your face. Very good. Back to the center. I want you to point your toes outwards, which is your plantar flexion. Very good. Bring it back up. All right, good job. So let's check the strength of your hamstrings and your quadriceps, as well as your lower leg, okay? So I want you to raise your leg up, and I want you to resist when I push down. Very good. Now keep your leg up and resist as I push up. Very good. That's your right leg. Now let's do your left leg. I want you to raise your leg up and resist as I push down. Very good. And left leg, resist as I push up. All right, very good. I want to do the same thing with your feet. So I'm going to have you resist when I push down to check the strength of your dorsiflexion. So go ahead and point your feet towards you. There you go. And I'm going to do the same with your plantar flexion. I want you to resist as I push against it. Very good. Okay. All right. Now, since I touched your feet, I'm going to remove my gloves. I'm going to perform hand hygiene and put a new layer of gloves on. Okay. So I also need to check all of your pulses. So I already checked your carotid, which is in your neck. Now I want you to check your brachial pulse, which is right above the bend of your elbow. So I'm going to check your right one side first, and then check the left. Do a bilateral check of your pulses. Then I'm going to check your radial pulse on your right side, and then I'll check bilaterally your left side. All right, very good. I already checked your apical pulse earlier, so now I'll do your femoral. Check the right side first, and then I'll do your left, which will be bilateral. All right, I'm going to work my way down to your dorsalis pedis pulse. So I'll check one side first, and then I'll do the other side at the same time. So that bilateral checks. Then I'm going to check your posterior tibial pulse, which is right here, and then on the left side I'm checking first, and now I'm going to check the right side as well. All right, very good. Now I want to check for sensation, so I need you to close your eyes. What I'm going to do is I'm going to touch a part of your body. You tell me what's the location and the side of the body that I'm touching, okay? Which side, if it's left or right, okay? So I'll have you close your eyes. All right, so.
Right cheek. Left hand. Right shoulder. Left cheek. Right hand.
Okay. Now we'll do about 48 of these touches just to make sure that you have good sensation, okay? So let's go ahead and check for gait now. So I'm going to have you step out of the bed, please. Okay, so you're going to walk normal towards me and walk back. Okay, now I want you to walk on your tippy toes and walk back. I want you to walk on your heels and walk back. Okay, and now I want you to walk heel to toe. Very good. And walk back. Okay, now I'll have you stand with your feet together, hands to your side. We're going to do the Romberg test to check for your balance. You'll stand there with your eyes closed for 20 seconds, okay? So go ahead and close your eyes. Okay, 20 seconds has passed. I'll have you go ahead and have a seat in the bed. Okay, you can actually lay down. All right. Do you feel any pain, any discomfort after doing all those motions, any dizziness, any abnormal feelings or symptoms at all?
No.
Okay, thank you. I think we have completed your full assessment. Please let me know if you need anything. Here's your call light. You can go ahead and call me if you need anything at all, okay? So now I'm going to perform hand hygiene, and I will chart my findings for this patient's physical assessment, which will be normal.